My name is Shontae and I am a private practice dietitian. I work out in Geraldton. I'm now working in a very varied role that I really enjoy. Yeah, I did actually warm up to the idea, and then once I came up, I'm actually really glad that I did it because I've ended up staying here. I did a 6-week community placement here at WACRH, and I really enjoyed the stuff we did out at Mullawa. So that is kind of a smaller rural town, about an hour outside of Geraldton. Did a program with the Mullawa Women's Program, a mindful eating, nutrition and cooking one, eating at the school canteen, a healthy eating stall with the kids, a radio interview. The only challenge I could really think of is that my placement partner, she was living with family while I was here. That was maybe the challenge at the start, but then I ended up kind of making other friendships, so it was fine. It was probably when we were doing the program with the Mullawa Women's Club, predominantly Aboriginal women, so that opened my eyes on the importance of cultural safety in program. We had an Aboriginal officer who was someone who works at WACRH, and she grew up in Mullawa, and she was really great at bringing people in. There's lots of other students from other disciplines here as well. So I learned lots about what OTs do, because we had some OTs that were doing lots of stuff with us as well, so that was really valuable. So Geraldton is very close to lots of really cool spots. Going for a day trip or camping to places like Kalbarri or Dongra or Sandy Cape. So seeing the wildflowers if you're here during wildflower season. Go to free yoga or to your run club and then get a coffee at Quiet Life. Definitely be involved with doing your uni work. Try and do some of that extra stuff and doing things on the weekend and building relationships with other students and other health professionals, because they might be your future colleagues or future friends. So yeah, that would be my advice. Actually didn't. It was not something that I had really thought about very much. Lots of people from my cohort did end up working rurally, and I think it is a really great opportunity to get outside your bubble and get some different life experience. There was a role with one of the dietitians I was that was involved with one of my projects when I was on placement here, so that was actually my first job after I graduated, was in a private practice with that dietitian. I think it has been a perfect first postgraduate roles. It is quite varied. I'm doing dietetics in lots and lots of different areas, getting good experience and a good idea of maybe what I like more than other things in dietetics. I think that's quite common with rural jobs. There's lots of things to do, and there's maybe not always so many dietitians around or health professionals, so you get a really varied role.